Mr. Sarbanes, both dealing with mental health in children. Ms. McMorris-Rogers asked about suicide during COVID and versus COVID deaths for children. Mr. Sarbanes talked about the importance of school-based health care, particularly focusing on the fact that the schools provide some mental health services to students. And I'm just wondering if either one of you have any plans or if there's anything already in the works to do a long-term study of the mental health impacts of us shutting down society. And while children, clearly I think the evidence is there already, or at least it appears to be, that there were more suicides because of the isolation, because they were removed from friends and so forth, then probably there were deaths from COVID, and Ms. McMorris-Rogers pointed to some data. But even for other classifications, there were suicides that were brought on by this isolation and significant mental health problems that were increased as a result of that. In fact, one of my colleagues who was a year or two older than me in competitive swimming back home and who consistently was 2 to 3 body lengths in front of me had some mental health issues. And when all of a sudden everything was closed down and there was no science to believe that if you're swimming in a vat of chlorine, COVID can survive, we shut them all down. And during that shutdown period, he committed suicide because his whole world at this point in his life had become his swimming and coaching young swimmers to be the best that they could be. I'm just wondering if either one of you has plans in your agencies to do a study on how severe the mental health impacts were as a result of us shutting down society in COVID.
So within our NISDA, and you know, I first want to say my condolences to your friend. With our NISDA, the National Survey on Drug Use and Health, we did include some questions related to the mental health and substance use related impacts of the pandemic. So for example, young people did report that the pandemic negatively impacted their mental health. We also had reports of individuals reporting that they use substances more to cope with the pandemic. And we also see there were questions also related to suicidal ideation, and so we did see increases in suicidal ideation.
Can you get that data to us and maybe consider other ways to look at the impacts that had? Because I don't think COVID's going to be the last virus we have to deal with, and let's make sure we do a better job in the future. Ms. Johnson, do you have anything to add to that?
I would just add, I would share the condolences that Miriam referenced for your friend, and also just say, as a services agency, so much of what we do is make sure that services are available to folks, and so we sort of defer to our colleagues across the agency on the research component of it, but we know that what has been critical is being able to deliver services and have a robust workforce to help meet the mental health needs of children pre-pandemic and increasingly during the pandemic.
All right. Back to you, Ms. Delphin-Rittman. CARES Act directed SAMHSA to revise 42 CFR Part 2, which for folks at home deals with the confidentiality of substance use disorder, SUD patient records. The goal is to better align this section with HIPAA regulations to improve the ability of individuals with substance use disorders to get safe and effective treatment. Updated regulations were required to be released in March of 2021. What is the status of these regulations? Why has there been a major delay? I mean, and I will tell you the reason we put that in there was we had heard testimony from and I remember one family in particular where the brother had been a substance user, particularly opioids, and then was injured in an automobile accident, was unconscious, got to the hospital because they had no records on his substance use disorder. They pumped him full of opioids, and it wasn't the accident that killed him, it was the overuse of opioids about 3 months after the accident. So where do we stand on these regs, and why haven't we gotten it done?
So that work is currently underway. It's currently underway and can certainly have a follow-up.
When do we expect it? Because it was supposed to be out last year.
Yeah. I don't have an exact date, but I
Can
can
you
certainly
get me some
follow up.
info on that, please? Because we can't be this late on these important issues. Last but not least, I see I got a whole 7 seconds. I'll just tell you that I have a bill, HR 7237, which I think is going to be coming up later this year, Reaching Improved Mental Health Outcomes for Patients Act, and it reauthorizes a lot of things that I think we can all agree on. And I yield back, Madam Chair.
Gentleman yields back. Chair now recognizes the gentleman from Oregon, Mr. Schneider.